Hey everyone, welcome back. Dr. Drew Ramsey here. Let's talk about what you can do during the winter months to keep your mood up. Whether you're suffering from actual seasonal affective disorder where you have major depressive disorder, but there's a variation, a seasonal variation to your moods, or whether you're just having the winter blues, just feeling less motivated, more down or sad, or just having a harder time with energy or sleep during the winter months, it matters to have a good plan and to be proactive. So let's talk about some of my favorite tips and things that I do in my own life and I recommend to patients as we approach and are in the middle of winter. A lot of times I see there's an interest in this in like February and March, and I always think, I mean, it's always great to make a move, but I always think that's a little late. We want to be thinking now earlier and in October and November and December about how we can keep our mood and activity levels up. All right, so tip number one, move beyond vitamin D. Vitamin D is a very important fat-soluble nutrient. You want to have normal levels. For most people, this requires taking a supplemental vitamin D, especially during the winter months, and getting some sunshine. We make vitamin D. However, most people are low. That said, supplementing vitamin D or vitamin D's correlation with depression, there's a lot of inconsistency in the data. Even giving people vitamin D supplements really doesn't do enough often. However, we know being low in vitamin D does contribute to your risk of depression. So get your levels normal. That's tip number one, but have more going on than just vitamin D in your plan. Number two, nutritional psychiatry. As we enter fall and winter, a lot of my favorite brain foods come onto the menu. At the top of the list is going to be lentils, where for just a cup, around 250 calories, you're going to get 90% of your daily need of vitamin B9 folate. You're also going to get a tremendous amount of fiber. So lentils are just a great choice. You should be seeing it in your soups and your stews. Next up would be all of the squash and pumpkin that we're seeing. All these orange vegetables have a great amount of carotenoids. This is this large family of fat-soluble phytonutrients that are just absolutely fascinating and really great for our health. So really paying attention to doing more with your diet during the winter months. A lot of times we make these jokes, right? It's carb craving. Hey, they're great carbs during the winter months, and they're part of our dietary pattern for a reason. So whether it's the purple sweet potatoes or squash or lentils, really thinking about how to optimize the nutrient density of your food choices during fall and winter is a really important choice and a set of choices when it comes to thinking about your mood during the winter months. All right, number three, medical workup, and consider things like medications. And I'd also put some supplements on there that have an antidepressant effect. Why? I just find a lot of times clinically, people sit on really struggling with depression and low-grade depression throughout the winter months, and a lot of times they've never tried something, whether it's a multivitamin or omega-3 fat or Zoloft or Prozac or just engaging with a healthcare provider. And I also find a lot of people never get a medical workup. So lots of things can cause depression: B12 deficiency, B9 deficiency, having too much inflammation, so having high blood pressure. I mean, there's a lot of things that you want to check out. The fall is a great time to check out a annual visit with your doctor. So just to put in there, make sure that medically things are okay. And if you're having severe symptoms, think about some of the options that, oftentimes because of stigma, we just don't put out there when we think about winter or seasonal depression. All right, what are we on? 4 now? Number 4, I would think about a light box. And a lot of people haven't used a light box. There's a lot of research around seasonal affective disorder, winter mood, and getting more bright light, especially in the morning. And so the treatment protocols usually are people getting a light box, at least 10,000 lux, and staring really kind of close to the light, not staring at the light, but ideally reading while the light is on your face, getting into your eyes. Another way to approximate this is just really make sure and get a lot of bright sunlight as soon as the sun gets up. You want to get this without sunglasses on, not through a window ideally, so ideally outside. But using light, because there's less of it for most people in the winter, and so thinking about how you can really optimize light and potentially augment it with a light box. All right, next tip is transition your exercise and movement into the colder months. I find a lot of people maybe have a great running or summer exercise routine. They're really active, they're out swimming, and it's just easy to get outdoors. And a lot of times they don't transition into the winter months. So whether it's a pair of running gloves or extra warm socks, my hands and feet get really cold. And as you know, I spend a lot of time really active in the winter. And so having the right stuff to keep my fingers and toes warm, having a good set of long underwear, kind of gearing up just a little bit so you can be prepared and be comfortable as you're doing all the movement that you need to do. One of the most powerful tools we have to keep our mood up, as you all know watching this, is exercise and movement. So really doing everything that you can do or identifying any barriers in your way to get that going is certainly one of the things that I ask people to focus on. And then finally, make sure and get social and think about the structure of your social life during the winter months. Again, it's really easy during the summer for a lot of people. The days are long, it's fun to go out, people are meeting up for picnics, but in winter people can get a little more isolated. And so making sure that whether it's having people over for a potluck or making sure to go out and listen to some live music or go to a yoga class or a community event, make sure and just double down on your efforts to stay social so you don't isolate. We know that just makes depression and mental health concerns worse when we feel that we're alone with them. Wherever you are, I hope this helps you as you think about your mood during the winter, and I hope you hear my encouragement to really get an active mental fitness plan. Just sit down, it doesn't have to be complicated. Spend a few minutes with yourself, think about what are some of your goals, what are some of the things that you know about yourself, and what are some of the things that work. I hope some of these tips help inspire you to think about next steps, and I hope this helps you have a really great, active, creative, loving, fun winter. I'll see you in the next video. Thanks so much. Make sure to subscribe below, and if you want some more tips like this, or you're interested in more of the research and information going on about mental fitness and nutritional psychiatry, make sure and sign up for our newsletter on my site, drewramseymd.com. See y'all soon.